Hello, my name is Alyssa Nochi. I am a nurse practitioner who takes care of patients with polycystic kidney disease quite frequently. I am joined today by one of our wonderful patients, Kate Nowicki.
Hi, I'm Kate. I have polycystic kidney disease and I am in stage 4.
Excellent. So we are here today to talk to you together about how to become your own medical advocate as you navigate your disease process. So here is the activity disclaimer. And then neither of us have anything to disclose. For the purposes of this presentation, all of the discussion questions that Kate will be answering do reflect her own opinion, just so you know throughout the course of the presentation. So to start off, just to clearly define what a medical advocate actually is and what this means for the purposes of this conversation today, is that a medical advocate is a person who helps guide through the healthcare system. So for a patient, that means everything from start to finish. So screening for a disease process, the diagnosis of such disease process, treatment, and then following up on options and monitoring for progression as things are going through everything. The medical advocate is also responsible for helping communicate with healthcare providers. So a major role in giving and receiving all necessary medical information. So when we talk about medical advocacy, it's really important to know what the goals of advocating for a patient or for yourself as a patient are. So one of the things that we really want to talk about today is moving away from a negative subtext. So what that means is moving away from the idea that you're fighting against somebody and fighting more towards better outcomes and more towards a partnership between patient and provider so that together you can form a team that will work towards a common goal. So this is kind of a big question mark, is how do you actually do this for yourself? So hopefully today we can define some of those steps and some of the ways that you can do this for yourself as a patient. So to get things going, I'd like to just ask Kate what it actually means to be a medical advocate to you. What do you think is the most important part about advocating for yourself in your healthcare world?
Okay, so to build on what you said about the negative connotation, I feel like whenever I hear somebody discussing being your own advocate, it's usually in the face of something not great. Like somebody has received a bad diagnosis or they weren't treated with respect or fairly. And that's when people sort of raise their arms and say, no, you've got to advocate for yourself. But it's more than that. Self-advocacy does not have to wait for something to go wrong. It's something that we can do all the way through our disease progression. And it's a way to get together with your team and meet them halfway. So I have to bring with me knowledge. I have to bring with me an understanding about what's going on. And I need to be able to communicate these things to my provider or my team so they know what's going on with me. And there's nobody better to do that than yourselves, or there's nobody better to do that myself because I know who I am. And I know what's not normal and what is normal and things like that. Yeah.
Yes, I love that. It sounds like you really take a proactive approach to your care and that it takes place throughout the entire length of your process and your disease, not just when something goes wrong that you need to fight for. So I
Right.
really like that idea. Okay, so when we talk about moving towards partnership, historically, healthcare has worked a little bit differently than it does now. So healthcare used to be really focused on the disease itself and on the condition. So a patient had kidney disease and you were looking at them as a patient with kidney disease and not as a patient themselves. Then everything fortunately started to shift more towards focusing on the patient themselves. And now we're moving more towards a space where we are focusing on shared decision making. So that means that everything that's done between the patient and the provider is actually a joint decision rather than one person dictating the care to the other person. So when we talk about patient-centered care, what does that actually mean? That's an objective that healthcare should be meeting. It's a key goal in everyday healthcare management. So this means that we're moving away from disease-driven care. So not just seeing somebody as the patient with kidney disease, but seeing them as a patient that I'm caring for and working with, and they happen to have kidney disease that we are working on managing. So the goal of patient-centered care is to be respectful and responsive to patients in general. And it's proven to be very valuable for both patients and providers. mostly because the benefits to the patient are phenomenal. So you see increased health outcomes, you see better relationships with the providers. So things just go a little bit more smoothly when you get along in those trust between patient and provider. Patients are more satisfied with both their care and the outcomes. And then there's also increased agreement with treatment because there's a level of trust there. So you can build on that as you're determining a course of action. Now, we can take it one step further and talk about person-centered care, which sounds a little bit different, but it's a little bit similar, but it's actually very different. So this is, again, a focus on the individual, not just the disease process itself. But this is actually encouraging the patient to have an equal role in their care to the provider. So you're not just receiving this care, you are an active participant. And this is where it really helps, where, like as Kate was mentioning, to take a proactive role in your healthcare. So there are 4 key components to this concept. And so one is that the care is going to be delivered with dignity, compassion, and respect, because you're really focusing on the person themselves, not just the numbers, not just the science. Care is well coordinated. So that means that I'm going to focus on what it is that the person actually needs to make sure that we reach these goals together. And so that's taking into account any clinical, social, emotional, practical needs. So if somebody wants to increase their exercise, but they don't live in an area where they can exercise outside frequently, it's finding ways to adapt around that and really focusing on what the individual can do and how we can get it done. And then this type of care enables the patient to have an active role in their care because you're really focusing on what they have and need and can do. So the goal is going to be to get to this shared decision-making point. So this is where you reach the point where we have a full partnership between the patient and provider. So it's a very equal relationship. So that means if I'm the provider taking care of someone, I can take into account all of the different things that my patient prioritizes for their own care and what their preferences are and how we can reach a common goal, basically. And then that common goal is going to be improved health and improved health outcomes for that patient. But rather than just saying like, this is our target, it's going to be, how do we get to this goal together? And so this allows the patient to have a greater understanding of what's actually going on. And then it also can change the way that they perceive their different treatment options. So they're not just being told what to do, but they actually get to play a role in choosing what they do and what their trajectory will be. So we can think of this again about a few different steps and a few different pieces. So when we're talking about the person-centered care, we're looking at the provider learning more about the patient as an individual. So one of the things that's really important here is to clearly outline perspectives and preferences. So ensuring that the patient understands what's going on. So as a patient, you can sit there and say, I really don't understand this process. What do you actually mean by this? And clarifying those different steps, so that they can really play a role in understanding how they view everything, and then share their preferences with the provider. So this is also a good opportunity for relationship building. The better you understand somebody, the better you're going to be able to move towards that common goal. The joint decision-making really comes from that building trust between patient and provider and really forming that solid partnership. Again, things go more smoothly when both players are on the same team. So the key part from the provider perspective is to include patients in the discussions regarding treatment options, but then also for the patient to say, I want to be an active participant in this conversation about treatment options. So asking clarifying questions, gathering more information, et cetera. And we'll talk about that a little bit later on. But really want to take time to understand all options. And so that's for patient and provider. So if the provider only offers one option for a treatment, the patient can say, what else is there out there? What are my other options? And then really work on that joint decision-making process. Really, again, the goal is to reach this common outcome where the relationship is going to be formed and you can continue to keep this relationship going over time. And this will really have positive clinical and patient reported and provider reported outcomes. I feel better about the care that I give patients when I know that they understand what they are going through and that they chose that this is the path that they want to follow. So that goes from everything from diet recommendations to medication treatment options and anywhere in between. Some of the benefits of using this type of model is going to be that the patient is more likely to choose options that better fit with their priorities, which means that they're going to feel better about the care that they're living with every single day. So if you talk about medication options and the patient is the one who has to take this every single day, they have to feel good about that choice in order for them to be successful with taking it. It's a chance to increase comfort with decisions for treatment. So the more you talk about something, the more you understand your options, the more comfortable you're going to be with what the ultimate choice is. And then like, because of all this, the patient just has more ownership in their care, which means that they're going to feel more comfortable with their own options because it was their decision to follow that course. Some of the barriers, as you can imagine, really come down to communication. So this can be on the provider level, because we've all seen providers who we feel like didn't really understand our priorities. I certainly have. And then but it also comes on the patient side too. So this is an important place to realize that as a patient, as Kate was mentioning, it's important to say like, hey, this is different for me. You know your body better than anyone else does. So you're the one who's going to recognize when something is different. And communicating that with the provider will really help. So communication is really challenging. So this is obviously a barrier to moving towards that partnership. Time constraints on both sides. Everybody's busy, everybody. And so
Yep.
it can be really challenging to, send it, to get messages. It can be really frustrating on the patient end when it takes 2 days for your provider to get back to you on something that you might feel is really urgent. And then, it can be really difficult when, you don't have time in your workday until 7 o'clock at night or 2 o'clock in the morning to send a message. And then, there's no immediate response because it's after hours. It gets really frustrating on both ends. So working around those time limitations can be really challenging. And then, of course, people can be challenging. Not everybody gets along all the time. So it can be really difficult to build a relationship. You can be the nicest person in the world and still not be able to reach every single human being. And that's unfortunately just life, but these are some of the major barriers here for moving towards that partnership. So to take a step back for a second, I would love to hear from Kate on what your experience has been with this shared decision-making process, particularly related to your PKD diagnosis, treatment, management, et cetera. And have you ever used this shared decision-making model from the patient side, and how did you actually feel it changed your care?
I have utilized that quite a bit. Most recently, I had questions about possibly doing a de-roofing procedure and ablation. So I had gotten this information that this was a treatment possibility for me. I brought it to Alyssa and Dr. Dahl and asked them what their opinion was. Dr. Dahl said that the open surgery for, sister roofing was not something that was probably going to benefit me too much. She left it up to me though. She said, okay, well, you could try it. And, but she said she didn't think that it was going to really help. So I took my information to my provider. Provider gave me feedback. And from that feedback, I worked with my doctor to figure out the best way forward for me. And I did decide against doing it. Same thing, I'm having issues secondary to my kidney disease. I have thyroid issues. I had half of mine out. My levels are starting to climb a little bit more, and we are kind of in agreement that, okay, we're gonna, maybe not do anything about this just yet, because I am getting so close to transplant. The hope is that it would resolve, but it's just, we're just going to keep an eye on it. And I feel good about that. So it's, being able to reach a consensus with my providers is paramount. Like, I don't really ever feel the need to fight too hard back, but if there is something that maybe, I'm pretty adamant about, I could always get a second opinion. And that's something that I know I can always do, or I can get more information from someplace else and then go forward.
Yes, absolutely. And this absolutely does come up. People come forward with questions regarding information that they have heard has worked for other people, and it's making it an individualized approach. So maybe the de-roofing procedures have really worked well for others, and it's a great option for people who need that, but it may not be the perfect option for everybody. And so you really got both sides of both options and then really made the decision that was going to best suit your preferences and your priorities for care right now. So I love that. That's exactly how it works. So moving forward a little bit, we're going to talk about patient engagement. So patient engagement, or being this participant in your care, is really the most powerful tool that you have as a patient. So this means that you are more active in advocating for your health, and it gives you a little bit more responsibility for actually doing the advocating. So you should feel empowered to discuss care with your provider. As we've both said now, you know your body better than anyone else. So for you to come forward and say, you know, this is something that's different and this is something that's bothersome to me, you should feel that you have the power to come forward and discuss that with your provider in order to best reach a decision. And then, you know, it might just be something that felt weird and you just needed to talk about it with someone else, and it may really truly be the sign of a problem. But you being engaged with your provider and communicating these changes to them is really going to be the most powerful thing that changes how your healthcare goes in general. So when you're actually trying to be a patient navigating this shared decision-making process, what does it mean to actually say, this is the role that I want to play in my care, and why should you do that? So if we talk about using the shared decision making and using this process and really saying, you know, I want to be an active participant in my care, I want to be proactive instead of reactive, it's associated with better patient outcomes. Things go more smoothly when you feel more comfortable with what's going on. You feel happier with the decisions because you got to choose what your decision was. And then you feel more comfort with the treatment that comes up when you and the provider are working together for it. Now, in the opposite way, if you don't use shared decision making, or it's more of a care plan that's dictated to you by a provider rather than one that you participate in, that's going to be associated with worse patient outcomes. Typically, patients don't feel satisfied with their care and may not trust their provider as much. And then you actually see a higher use of healthcare. So that means like more urgent visits to places, because you don't feel like you have that relationship with your provider where you can call and say, hey, I have this going on. I'd really like to talk about my treatment options, et cetera. So from the patient side, so the provider should be expected to be performing these roles. This is something that healthcare is moving towards. It's really a big movement for patient-centered care and to shared decision-making. But it is a two-way street, so the patient does still need to come forward. Right? It takes two to tango, so you say. So you want to be, as a patient, in a position where you feel comfortable with coming forward with this information. So as you can see, it's really beneficial when you do this. So again, as we talk a little bit more about wanting to move towards this shared decision-making and playing a role in it, again, we can kind of think about the process in terms of 3 steps. So when you're actually going through a process as your own medical advocate, so let's say starting with diagnosis of a problem and moving straight through everything, the first thing you're going to want to do is kind of build that team relationship. So this is an opportunity to really work towards education, gathering the information from your provider, from outside sources, from friends, from family, et cetera. Discussing the available options with the provider, understanding the different options as well. When you're doing all this education and discussion, it's also a good chance for you to develop a relationship with that provider. So if something doesn't work for you, everybody learns in different ways. This is a good time to communicate. For example, some people don't do well when they just hear a lot of information, but they do really well when they read it. So this is a good opportunity to also say, you know, like we talked a lot about this. What are some sources of information that I can use to further investigate this? And do you have any written material? And then that's going to be like, I, as an adult learner, need a little bit of help with learning in this style. And it's a chance to really build that relationship and trust the process. Also a good chance to share priorities and preferences, as well as your goals for treatment. Your goal may be that you just want to be comfortable. Your goal may be that you want to slow the progression as much as possible, work towards transplant, whatever it may be. Some people have different preferences for care, and that can be literally anything. There are going to be religious priorities that may change care. There may be accessibility issues that may change your preferences in course of care. You may have to take care of children during the day, so you can't do certain things during the day, but you can do them in the evening, etc. Understanding those things are important, your day-to-day life, is going to drive your treatment options, sharing that with your provider is just going to be helpful, because then you're reaching a place where your priorities and your preferences match what's actually going to be offered. So basically, as the patient, you should be aware that your preferences matter. Your preferences are driving this conversation. And because anything that we are asking you to do is only going to be possible if it's something that you want and can do. The next stage is going to be discussing the options themselves. So as you're moving through treatment options, you really want to discuss all of those options in details. And then you want to understand the good things and the bad things that can come out of that decision for each option. Someone may say this is the best option for you. You still want to say, like, well, what are my other options? Because it's still up to you to know what those other options are. And then you also, if you are presented with multiple complicated options or many choices, take some time to decide between those choices. You don't have to be put on the spot to decide within a 5-minute window. You can say, you know what, can I have a follow-up telehealth visit in a couple weeks to really go over it again and talk about my decision? And, you know, nobody's going to say, no, you can't take time to think about things unless it's an emergency. But basically, you should be offered as a patient time to discuss, to consider those options. You also should be given the opportunity to ask questions and confirm details. So if you don't understand something, say it right away, and or, you know, think on it and then come back and say, you know, I'd really like some clarification on this. And this way you're taking more of that proactive role that we talked about early on in the beginning. And you really want to see how those options match what it is that you want to do. And when you reach the point where you're making a decision, you're going to be establishing an informed decision. So that means that you have been given all the information about your options and you made that choice based on all the information that you had. This is going to be preference-based, based on what works best for you and what you would prefer. And then it also gives you the opportunity to evaluate the decision that you make. You're not locked into any one choice that you make. So you can say, you know what, I thought about it. I've tried this. It's not working for me. Can we go back to the other options? But the patient should be able to make an informed decision and then be aware that you can change your mind at any point in time. So as we're talking a little bit more about becoming your own medical advocate, some of the tips and tricks from the patient side. So making the most of an office visit or a telehealth visit or a phone call. You know, providers are busy. Sometimes things seem rushed. So how do you get the most out of that time? We'll talk about that again in just a moment. Utilizing some effective communication strategies. We'll talk about that again in a moment as well. Asking questions. I cannot stress this enough. As a patient, you have the right to ask as many questions as you need to, and your questions should be answered. And if, you know, maybe some questions are completely unrelated and the provider may say, you know, why don't we revisit this again? That's fine. But, you know, we now have mechanisms for communicating beyond just that one-on-one face-to-face visit time. So utilize those options that you have. If you have a patient portal, send your questions later. And, you know, it may not be an emergency that you get those questions answered right away, but you still deserve an answer to them. May be helpful to bring a friend or family member to appointments with you if you feel comfortable with that. Mostly just because a lot of these options may be very lengthy discussions, they may be complicated, they may overlap a little bit and get confusing. So it sometimes helps to have a second person be a listening ear for you. I would recommend, if you're going to bring someone to that visit, make sure you clearly define with them what their role is during that visit. Do you expect them to answer questions for you, or are they just an information gatherer with you? Just so that way they are clear of the dynamic when they go into the room as well. You don't want it to be a distraction to your visit time. Consider all your options before making a decision. Like I said, this concept of shared decision-making and patient-centered care really relies on you taking the chance to consider everything that you want and choosing what works best for you. So you have that time to consider your options. Do your own research. We'll talk a little bit more about this momentarily as well. Staying in communication with your providers. This is, again, a chance to use as patient portals, telehealth visits, other mechanisms of communicating with your provider regarding things that may seem abnormal, or if you have any questions to clarify any concerns about treatment options. But really use your own judgment. If something doesn't feel right or you don't feel comfortable, you don't have to wait until, you know, something's really a problem. You can say, you know, I'm starting to experience this and I'm not sure if this is normal with this medication or this therapy or whatever else it may be. Keeping track of your own health, this is a huge benefit for you. as a patient. So basically, this can be anything from keeping track of your blood pressures or your blood sugars or your medications, bringing a med list with you to your appointments, or really understanding what medications you're on, keeping track of your different appointments and your different medical providers. Some people see 6 or 7 different specialists, and it can get really confusing when people say different things. So really having a good list of your own information as much as possible, so that when somebody tries to change things, you can say, oh, I appreciate that thought, but Dr. So-and-so really wanted me on this medication because A, B, C, D. And then that way, you're not just blindly getting confused for no reason. You can play an active role in navigating some of those things. So when we talk about making it the most of a visit, really important to kind of just consider, what are the most important questions that you need answered in that 15 minutes or 30 minutes, however long you have. Stay focused on the reason for that visit so you don't get sidetracked. You want to make sure you get the most out of that short period of time that you have. You definitely want to be sharing all information that you feel is relevant to what you're being asked or what your concerns are. And you want to be open and honest about those things. So if you are getting headaches every day, you want to say, I'm getting headaches every day and it's right here. You don't just want to brush it off and be like, oh, but I was stressed, right? Like, you want to, if this is something that's a problem for you, you want to make sure that you share it. You never know what may be relevant and what may not be. You also want to share your point of view regarding your symptoms and your decisions. And not every question will have an answer, which I think is very frustrating as a patient. Not everything will be identified, and it might just be some weird little quirk, but it may also be, there may also be an answer that you don't like. And so kind of understanding where you want to go from there is also another big decision that you can kind of think about, but you don't have to put it on the spot at that time. Take the time to reflect and see how you feel about things later. We'll move into effective communication. So a couple of different pieces here. Communication is important because it's going to improve the diagnosis and decision-making process. So for you as the patient, your role in this process is to share all of your symptoms and anything you may feel is important. You know your body best. We've stressed this a few times today. Communication allows you to collaborate in your care, move towards that partnership again. So you want to be honest about your priorities and then your preferences, and then understand that you have the right to choose what is best for you. Communication also establishes a meaningful partnership and relationship. So this is the chance for you to create that partnership with your provider. Shouldn't just be one side where they're telling you what to do and you blindly listen. You play an active role in all of your care. And then doing your own research, we'll talk about just very briefly. There's a lot of information on medical conditions out there, so you want to be careful about what information you interpret as correct and incorrect. Many websites do not actually have to be overseen before information is posted, so you should also consider the information from more than one source. So giving Kate another chance to kind of speak up and talk to you all a little bit. Where do you find, Kate, the most effective sources of information regarding everything that you go through for your medical care?
So you did mention the danger of bad information, and I think that's kind of a big problem. You may have noticed that in the past 2 years. I don't know, but not everything that's out there is good information or correct. So typically, what I try to do is really only pay attention to like some of the bigger publications, peer-reviewed medical journals. I mean, I don't usually have access to them, but an abstract is usually okay. And maybe hospitals like the Mayo Clinic has a lot of information. Polycystic Kidney Disease Foundation has, is that the name of the website, the PKD website? Like the official one. And, so I'm trying to stick with things that have some vetting behind them. And then anecdotally, I try to find out what other people have experienced or done. And that isn't, I mean, that's not completely a water, sorry, I'm so sorry. That's not something that I should rely on, but it's helpful. It's helpful to know what other people have gone through and what decisions they've made and how they've made out with certain things. So that's an important piece. And at no time does any of this supersede what my providers are telling me. So, I'm not getting this information just so, I can trip somebody up or, really stick it to them and say, oh, you didn't know about this, or, well, I read this, and that's not really, I don't think that's productive. It's not really how I work. But it's good to come in with something, some sort of sense of what's going on, some sort of sense of what your treatment options are, and then work with your providers to get this information. And the information has to be good. And if it isn't good, you typically will be told about that. So that's what I try to do.
Yeah, absolutely. I cannot stress there's so much bad information out there. So how do we actually work around some of this bad information when you're saying like, okay, is this good? Is this bad? You mentioned peer reviewed journals, and so not everybody's going to have access to those, even if it's an abstract. But there are a lot of websites that are out there geared towards patients. And so when you're considering, is this actually a good source of information? You can kind of ask yourself some of these questions as you're reading through a website. So who's actually responsible for that information? So if it's a governmental agency, that website is going to end with like .gov, which means that information is going to go through very clear management sources before it's posted. So there's going to be someone checking and verifying, make sure it's accurate so that they're not misrepresenting the government. Organizations will have websites that end in .org, like .org. And so those websites are, again, probably going to have someone who is controlling the information to make sure that what's being represented by their organization is accurate. Some of the other websites can get a little dicey. So you can also consider who wrote the content. Was it written by a provider? Was it written by a patient? Was it written by a random person who works in communications? A lot of times there's an author on a website. Also, when was it written? Sometimes this can be a little bit trickier to find, but information changes constantly. And so you want to make sure that you're not reading something from 20 or 30 years ago if there's new updated information available. Also, what is the purpose of the information? It might just be someone's opinion. It might be answering a question that's came up in research. It might be relaying research findings, or it might just be some random article just designed to answer a question. So you really want to understand that. Also, very important to make sure that your privacy is protected. So you want to be really cautious about websites that ask you to put in any name information, contact information, because there's tons of scams out there now. Also, any information that offers a quick and easy solution to any health problems is probably not going to be accurate information. I'm sure for all of you, you've witnessed things where there's like, miracle diets to lose 30 pounds in 10 days. And as tempting as they may sound, they generally are not based on accurate information. One of the other things that I also really recommend is reframing your search to see if different information results. And so I would actually encourage you to try this. So one of the things that I go through a lot with patients is, particularly for diet. So a lot of people will say, oh, I found that this, and this is really good. So if you, for example, I'm just going to use plant-based. So if you Google, is a plant-based diet good for kidneys? You're going to get a certain list of articles. If you say, is a plant-based diet bad for kidneys? You're going to get a different list of articles. And a lot of that information is going to be completely different. So when you change the way you word things, you may find a completely different outcome. So you just want to be really careful. And that's why it's really important to trust yourself in what you found. See, does this make sense? Does it not make sense? And then also trust your relationship with your provider when you bring it back and say, hey, I found this article that says XYZ is going to be really helpful for me. And then have that conversation about it. Oh, sorry. Okay, so of course, conflict is going to happen. We are all human beings. Not everybody's going to agree. There's bound to be differences that come up. So when this happens, it is very helpful to make sure that you don't get angry with yourself, with your provider, with anything. Human relationships are difficult, as we've said, and there's a lot of emotion involved in your healthcare, particularly something that's a chronic condition that can be quite complicated and very unpredictable. So some of these strategies to overcome conflicts when they come up is taking a time out. I cannot stress the benefit of a time out. So if there's if you have a really rough appointment and you're angry, then, leave and feel those emotions and be angry, but then just kind of like regroup and say, okay, breathe, stretch, shake, let it go is what I tell my patients when they get upset about things. Just take that minute, relax, and get over it and like continue to move on and just take that breather. But also reflect on your own opinions. So what made you so upset? What was the difference in opinion? Were was the information that you were given not what you wanted to hear? Did you find something was disappointing? Kind of figure out what it is that actually upset you and why that conflict happened and what your opinion is on that matter. Is it truly a fundamental difference in opinion, or was it maybe just something that you didn't want to hear at that time and it was difficult? Again, emotions are very challenging. There's a lot of emotion and strife and personal experience with kidney disease. And so sometimes things upset us more than on other days. So also consider the information that was provided, which is part of just saying is like, what was it about this information that was conflicting with my own personal opinions and views? And then, like Kit said, you always have the opportunity to seek a second opinion. There are a lot of providers out there, and there are a lot of people that you can ask for a second opinion if you think that the information you were given was not correct. One other thing to kind of consider is understanding that polycystic kidney disease is a very complex condition, very highly specialized. Not every nephrologist and kidney expert even knows a lot about polycystic kidney disease. So we see this a lot, that not every provider that you come across really understands all the aspects of what it means to have a PKD diagnosis. And so that can lead to a lot of frustration from the provider standpoint and like especially from the patient standpoint. So it's really frustrating for my end when, patients may go to a specialist and they're started on something that may not be truly aligned with standards of care for PKD. And so my role is to work through it with that provider, provide some education, and we'll go through it and reach a mutual decision. From the patient's perspective, it can be really frustrating. For example, if you go to the emergency room with abdominal pain and they don't listen to you, they think that you have an upset stomach. So kind of working through that frustration can be really challenging for a patient, but also important to recognize that this is something that is very specialized and not every single person is going to be an expert in it. So I'd like to bring it back to Kate again, and I would really like to hear about a time where you advocated for yourself, what it looked like and how it affected your care. You did tell us about the story about the de-roofing and the shared decision-making, which I love, but can you think of other instances where this has been either successful or unsuccessful and how it affected you?
Yeah, so I know you're probably sick of hearing this story, but a year ago I was on a vacation in Montana and I had a skiing accident. I hit a tree and I ended up rupturing a bunch of cysts, and I ended up in an ICU way far, from home. I was by myself. The group of people that I had gone with were all leaving the next day. And I had to be able to rattle off everything about my medical condition that I knew. I needed to remember meds, I needed to remember surgeries, I need to remember all the testing that I've done, what my numbers are. And I think at that time, Epic was not available yet to just grant through a different EHR, or maybe it was new, I just didn't know how to use it. But so I mean, here's this whole group of people. They didn't know any of my providers. They didn't know anything about me besides what it was that I was able to tell. So that actually was kind of a bit of a saving grace, because in this utterly chaotic and overwhelming situation, I was at least able to sort of not take charge of everything, but just sort of have a handle on what was going on. I was able to communicate my needs pretty efficiently. People were asking me, can I have contrast? Can I have this med? Can I have that med? And that worked out pretty well because, I had seen this emergency room doctor first. They found me a urologist who happened to have worked with PKD patients in the past. So I got lucky there. But before that, it was kind of a matter of trying to get me like stabilized and find out what it is, that I needed to, or rather that they needed to do, whether it was going to be a blood transfusion or some kind of, I guess, cauterization of the bleed. They were talking about maybe doing a procedure like that. So, I- when all was said and done, like, at least I had that. I was able to work with this group of strangers. They were able to work with me. And I probably wouldn't have been able to do that if I hadn't already been so involved with my care. in the past. So yeah, it's empowering. It was helpful to get like an efficient plan in place, because we need that. We're not wall people. We need to have some sort of um, direct treatments for ourselves. And so I feel like I was able to get that by communicating. Um, like Alyssa said, like not everybody is familiar with polycystic kidney disease. So, and I think I realized that one, excuse me, I'm so sorry. I think I realized that for the first time when, people like my OBGYN were asking me questions about it. And I was like, oh, okay. Like, I kind of assumed that, oh, everybody's going to know about this really weird thing that, but no, it's not the case at all. So, yeah, I just, it's valuable. It's very, very valuable to know what's going on with you. And it everybody wants you to get better. You want to get better, or at least, more comfortable or whatever. And providers really do most of the time have our best interests in mind, almost all the time. So yeah.
I would like to think that providers do.
Yeah.
But yeah, and I think one of the important things to really capture from this story is, I know we've talked about this story a few times over the past couple years, but it's one, advocating for your care while you were there and talking to these different providers and, communicating this is what I can and cannot do, but also you stayed in contact with your home unit,
Mhm.
which was also huge. So even across the country, your physician was able to track your CT scans and track your labs. And we were able to kind of keep an eye on things and stay in communication with the hospital, even though you were 3,000 miles away, or
Right.
however far away Montana is.
About
But
that.
yeah,
Yeah.
it's important. And so that's a really good example of when you were, as a patient, able to take your health information and what your goals were and really make the best of a bad situation. So now, can we do the opposite and think about a time where you were, as a patient, not advocating for yourself and why you didn't and how it affected your care in the end?
Okay, so I got my diagnosis when I was 24. It's not really a family disease. My father had it, but he was the original mutation, I suppose. So he passed it down to me. He wasn't aware that he had it until later on in life. So I had been in the emergency room for a different issue altogether, and that's when imaging was done and they found it. Um, my father was with me. He was actually a physician. He's passed now, but he was well up on everything. And while I was there and given the diagnosis, there was this um, dynamic going on between my father and the ER doctor, where they were like almost speaking to each other in tongues. I didn't know what they were talking about. They were making decisions for me, basically. It was I wasn't really included that much. I sort of didn't think to speak up. I mean, I was young. I was 24. I didn't really know, what, but I do kind of still feel bad about that. That in that moment, I wasn't really spoken to that much. I was, like I wasn't looked at as a patient who had any kind of like decision making powers. It was just between my father and the CR doctor. So um, looking back on that now, I wish I had said, okay, hey, can we talk about what things are going to look like for me, or what I should be doing, or why you don't want to give me this blood transfusion or anything like that. So it's yeah, that wasn't a good feeling to not be in on what's being decided for me. Um, I don't like that. Uh, of course, I trust my providers to give really good information. But yeah, in that situation, it wasn't very good. So I would suggest to everybody, try to do your best to avoid that. Being talked over or talked at, rather than listened to and engaged. It's not a good way to go. It really isn't.
I mean, obviously, it made an impact. You remember it all these years
Mm,
later.
yeah, yeah,
So it's one of those things you never really forget when you're not really treated like a person.
right. Right.
You were the condition, you were the person in the bed with that condition, but not the person getting the conversation.
Exactly.
Yeah,
Exactly.
so that's really important. And again, you were young, and a lot of patients with PKD are diagnosed at young ages. So it is complicated to kind of overcome that sense of not really understanding things,
Right. Right.
but also like growing from that opportunity. And I think you really took this time to grow from that experience.
Mm.
So that's a really good story. All right. So another quick question for you. So how have you felt about utilizing patient support groups when you are kind of navigating your own medical care and advocating for yourself? You did mention earlier that you get some information from other sources,
Mhm.
other people who have experienced it. So curious what your perspective is on patient support groups and how that has affected your role in care.
So this is a tool that I didn't really take advantage of until quite recently, and I wish that I had not. I wish I had gotten going on this a little bit earlier. So for people like me who maybe don't have the history of, a quarter of my family members having polycystic kidney disease, I mean, it was just one, and that's it. I really don't have a lot of people to talk to. Just in normal life, it never really comes up on the street or whatever, in casual conversations. So I did join a couple of support groups that have been really invaluable. Again, this isn't going to take the place of your provider's education and their recommendations for you, but it is nice to sort of hear everybody's experiences. A, knowing that you're not alone, that's good. But B, somebody could say to you that, they did something, it wasn't worth it because of this. And you can kind of try to, I mean, everybody's an individual. I'm not going to necessarily have the same issues as them, but that's sort of stuff helps, like to say, okay, well, these are the possible complications. I know someone that had X and Y happen to them. And that's also something that I bring back to my care team. Um, and usually it's for a reason, but I mean, it's just it's very it's helpful. It's an additional thing that we can do for ourselves. On Facebook, I believe they have a couple of really good groups, and they're all moderated by people who are either in healthcare or they are in the sciences. So they're really good about not giving tenuous or odd information, or things like miracle diets, like that. Those posts get shut down pretty quickly. But it's been wonderful. It really has. So that's good. Like as you said, like everybody's time is precious. What I get in a visit, I can't possibly put everything in. I can't possibly, communicate all of my fears that, I have. So it's, from like the comfort of my own home, or, quietly, I can have more in-depth conversations about certain things. And it's just, it's been wonderful. I would recommend that to anybody who might be interested. Find a good group, see what other people are going through, and, make some friends as well.
Yeah. It's a good opportunity for you to kind of define your own role too, right? You can be as
Mm,
active or as inactive as you want. You can just be an observer, or you can be a question asker or a question answer. There's a little bit of opportunity for everything.
that's true. That is very true.
Okay. So last question I have for you is, what is the most valuable piece of information you can offer to other patients? If you had to choose one thing that you wish everybody with PKD knew about advocating for themselves, what do you think that would be?
Ah, stay on top of your condition. And that's just having a good awareness of what's going on, what your numbers are doing, what things you have tried and maybe failed. I mean, I guess part of that would be maybe trying to gather more information for different treatment options as well. But I mean, just, have the information, get the information, try to find it from a good place, and then it's only going to benefit you, I think, in the end. So, you know, it's funny. We can't really control what's going on with ourselves. There's no way to really stop this. So I don't know about anybody else, but I certainly feel like kind of a you know, a futility, like a lack of control. You know, I can't stop this. But, you know, the best way I think to counteract those feelings is to, okay, at least, you know, I'm able to participate in my care and I feel better about making moves or choices that would really benefit me. Um, and developing relationships too. It's very helpful. I think that's probably the best way to counteract sort of the feeling of helplessness. Um, yeah, information is good. They're right.
Yeah,
Knowledge is power.
absolutely. I love that it brings us back to that common theme of taking ownership
Mhm.
and playing an active role and being proactive rather than reactive, which I think is really important. And you've really stressed that. And I hope a lot of other patients can get that out of it as well. Thank you for sharing.
Oh, you're welcome.
So that's all that we have for today. We have our contact information here. Um, it's been a pleasure to be here today and speak with Kate, and hopefully everybody had the opportunity to learn a little bit about what it's like to advocate for yourself as a patient, how you really try to strive for that shared decision-making process with your providers, and how you can make the most of navigating your disease process. So thank you for taking the time to listen to us today.
Thank you.
And thank you for being here, Kate.
Oh, thank you for having me.